Hello class, welcome to chapter 6 of medical terminology. Now chapter 6, this is a very short PowerPoint presentation if you've already read your book or if you haven't. Either way, you'll notice that part of the reason the PowerPoint chapter is really short is because the chapter itself is very short. Now I do want to start off by saying that you have exercises immediately upon the beginning of this chapter, starting on page 188 and going through 192. So please make sure you do those right away. The goals are to define the new suffixes and use them with the digestive system in combining forms. Now that's your exercises that you have in the book. Also, we're going to just review in this short presentation a list and explain some laboratory tests, clinical procedures, and abbreviations common to the digestive system. And then you need to apply this new knowledge, mostly you're going to get it from the book, to understanding medical terms in their proper context, such as medical reports and records. And there are a couple exercises in this chapter too for that, and there will be in subsequent chapters for sure. Now, even though this says x-rays, we're going to talk about laboratory tests and clinical procedures. Even though it says x-rays, these are considered clinical procedures because the patient is actually receiving a dose of radioactive isotope, and it's something that can definitely interact with the body systems, and until that's safely administered and the test is complete, it is considered a procedure because occasionally things don't go exactly right, but most of the time these are pretty safe. The first one is a lower gastrointestinal series, which is a barium enema, and basically barium isotope is introduced by way of enema, and it lights up the colon specifically. And they look to see if the colon is open all the way through and nothing's twisted down or scarred down or ballooned out, etc. An upper gastrointestinal series is where the patient is introduced, has a barium isotope. Sometimes there are other forms of isotopes that are used. Most often it's a form of barium, and they drink it. And it looks at the stomach, but mostly the duodenum and how everything's moving into the small intestine. And then there's a cholangiography, and a cholangiography is when the radioactive isotope is introduced into the bile duct, and they can take a look, they wait for it to light the entire bile duct system up, and they can see if there are any blockages or problems and things like that. And then computed tomography, CT scan, which is it's an evolution of X-ray technology, but it is X-ray, and it can be done without radioactive isotopes, but with digestive systems they usually use radioactive contrast so they can see everything very well. And it's usually used for a broad sweeping look at the entire GI series. Continuing with clinical procedures, and this is on page 196 in your book. You have an ultrasound examination. It's just like ultrasounds are used for a baby. They'll do an abdominal ultrasound, and they'll take a look at potential blockages, stones, things like that. Also, there's endoscopic ultrasonography. Now, that's introduced by means of an endoscope in through the mouth down into the stomach, and there's an endoscope, or an ultrasound generator at the end of the endoscope that will produce an image from the inside out rather than the outside in. Then you have magnetic resonance techniques, MRI. Most people are familiar with that, and that is still on page 196 in your book. And it is different than X-rays. Magnetic resonance imaging will show up much more fine tissue detail without the use of radioactive contrast. And then a nuclear medicine test. This is a hepatobiliary aminodiatic acid scan. That's on page 197 at the top. And this is radioactive imaging procedure that tracks the production and flow of bile from the liver and gallbladder to the intestine. So rather than just lighting up the bile duct system and looking at it in one shot, they actually are looking at how they introduce it in doses and watch the bile duct system produce and see if it's producing everything adequately. Some other procedures that we need to discuss. Gastric bypass or bariatric surgery. This is on page 197, where the size of the stomach is reduced. Continuing on page 198, you have gastrointestinal endoscopy, which is a visual examination of the GI tract. Again, they use an endoscope, but instead of it generating an ultrasound, it just has a small camera with a light on the end of it. They take a look and go down in through the mouth, down the esophagus into the stomach, and into the small intestine. Sometimes a ways to take a look at the GI tract. You can also have laparoscopy, which is a visual examination of the abdomen, and that's actually where they open an incision into the skin and open the abdominal cavity, pull back the peritoneum, and take a look around. Then a liver biopsy is a removal of liver tissue for microscopic examination. And then nasogastric intubation. This is on page 198 in your book, and a nasogastric tube is insertion of a tube through the nose into the stomach, and it usually has then vacuum pressure, general vacuum pressure that sucks out excess bile and things. Is most often used when people have some type of bowel obstruction. And then you have paracentesis or abdominocentesis, and this is a puncture to remove fluid from the abdomen. Again, class, chapter 6 is a very short chapter as far as lecture. It's very short as far as reading, and it's very short as far as this PowerPoint is concerned. But I do want to take this moment to tell you to pick up from this point forward. Start on page 200, go through the end of the chapter, and read a couple of case studies. There are the exercises you need to complete. Thank you very much. We'll see you chapter 7.